So the SWOG 1318 study began in 2013, and this is a NCI-funded cooperative group study in the United States where we were treating older patients who were not felt to be candidates for the typical chemotherapy that was being used with an able TKI at that time in older patients. And so the study was done in these patients. They received steroids and dasatinib as an able tyrosine kinase inhibitor to achieve a first remission. All of the patients, as expected, achieved a complete hematologic remission. And then they continued blinatumomab as a consolidation and maintenance after that. We will be publishing the results of this study, hopefully in the very near future. But as many of the viewers know, the GIMEMA group, led by Robin Foa, already have published the results of a very similar trial performed there, showing impressive CR rates, but also, more importantly, a more prolonged duration of that remission in patients receiving a very similar induction followed by consolidation regimen with blinatumomab. And so I think what we're seeing here is that for patients with pH-positive ALL, especially older patients who are not eligible for intensive chemotherapy or allogeneic stem cell transplant, we now have options that these patients can tolerate that do lead to high rates of remission and, importantly, prolonged disease-free survival.